Mary, whatever you did, because I am on now.
Yeah. Can you send me the link for pricing? Yeah. Give me one minute.
But I'm not coming through my computer. Now, yeah.
Yeah, you're coming through. I just have mine muted.
Okay, I'm gonna hang up my phone.
Okay.
So can you hear me on the computer? Oh dear. So it says here, Mary, you're hot and I'm connected. I don't know what that means, but until somebody talks, I don't know if anyone can hear me. So as soon as Beth Wyman joins us, this is Nutrition Matters with Beth Wyman. Since we are on the air, I will talk, and hopefully, I'm talking. Hello, Beth. Can you hear me? Hello, hello.
Yeah, you gotta click. Yeah, there you go.
Okay.
Okay.
Can you hear me?
Yep. Yeah.
Oh, I wasn't sure. With nobody on, I'm like, okay, I'm starting the show and saying hello, hi, hello, but didn't know if I was. Um, Sometimes my sound just kept going off. But it's the bandwidth for some reason on my computer. So, but hello, welcome everybody.
Hi.
This is Nutrition Matters with Beth Wyman, brought to you by the Hope Collection and Optimize Your Life. And we welcome anyone listening in, and welcome Beth. It's been a couple weeks, so it's exciting to touch base again and get some more great information from you.
Yeah. Thank you. I know it was a little bit of figuring out the podcast platform, which clearly I'm still doing. And then, yeah, I was off in Vermont doing a site visit
Oh, wonderful.
for a Head Start program. Yeah, it's been definitely a busy start to the year. I also took on the role as manager of the New York State Food as Medicine Coalition. So
Ooh.
there's been a lot of things happening.
Aha. Food
Um,
as Medicine Coalition. That sounds very impressive. And,
oh,
um, I am sure it's based in talking about healthy eating and eating the correct things and at the correct time. Am I off base saying that, or?
it's so it's more about access to healthy food and nutrition security instead of food security, or in addition to food security. Because our most vulnerable populations tend to have poorer diets, like poor nutrition quality to their diet.
Mm.
And by improving access to nutritious food, you can actually help to improve chronic disease, decrease healthcare utilization, um, and just see an overall improvement in quality of life for those folks too. So this is a really cool intersection of food and public health, and looking at nutrition as a what's called a social determinant of health. So think about like all those other factors besides like genetics that impact health outcomes.
Hmm. right? If your primary diet is fast food or, you know, things like that, I'm sure that that could cause, a big decrease in health. Um,
Exactly. Yep. And it's things like, um, for right now at least, there's this focus on chronic disease in food as medicine, so impacting heart health and diabetes. Specifically in New York State, we just had, well, not just because it's been since the fall, there's a Medicaid demonstration waiver, it's called, that was approved. And so we being the entire state, get to put into place all of these extra services for folks to address social determinants of health. And it's a it's what's called, like I said, like a demonstration waiver. So we're getting the opportunity to show how programs that impact those social determinants of health improve health outcomes. And then it gives us the opportunity to then make a case for these programs and projects to become like standing parts of state policy, or however they end up being funded long term. So it's a pretty cool opportunity to get to be a part of this. It's something that I followed from when they started this Food as Medicine Coalition as well, it wasn't a coalition yet, just a project, um, a few years ago, and then they became a coalition, I believe, in 2022, um, as to continue to make recommendations to New York State about how to incorporate food as medicine long term. So it's a super cool opportunity, and it's a lot of information to absorb, even though it's something that I've been keeping a little bit of a pulse on. Being directly involved every single day
mhm,
is so much information because I've it goes beyond just the individual implementation, right? So when you're looking at improving health outcomes, right? There's individual level, so that would be like what I was doing as a dietitian, the one-on-one visits, helping each person make personal decisions that improve their health outcomes. And that's always going to be a really important part, especially with food. I mean, probably in other areas too, but especially with food, since that's my focus. Um, because everybody's slightly different and everybody has slightly different needs, right? And you can't ever say across the board that everyone would benefit from something particular, right?
right.
So, um, generally speaking, everybody benefits from increased fruit and vegetable consumption. But if I've got somebody that has some sort of issue and they can't digest that type of fiber, it's like, well, you need to modify it. You need to make sure you peel your fruit and have cooked vegetables or very low fiber vegetables. So there's there's a nuance that's always going to require that individual level support, just because every body is different. And especially when you start dealing with people that have multiple health conditions, it makes it really difficult or complicated, right?
Mhm,
Um, because you can't even say, like, oh, okay, well, everyone with diabetes needs this intervention. It's like, well, yeah, but then you're missing they need extra stuff. Or if it's some diabetes and kidney disease. So it nutrition ends up
right.
being so nuanced, but that's okay. That's why dietitians exist. And that is our role, is to help with that individualization and personalization of the recommendations. Um, I was on a call, I was on a national call about food as medicine, and we were talking about the dietary guidelines for Americans because the new ones were published. And they said, well, these are great generally, but what about the specifics? What about like specific health conditions we don't see? That's the role of the dietitian, is to do that personalization.
Right.
These are exactly what they say. They're general recommendations for somebody without a chronic
Because
condition.
one time Ron had to be on a low fiber diet. And it's so funny because all you hear about is, high fiber, high fiber. Well, I mean, this is a number of years ago, and I can't remember what medical situation he was going through at the time. But, it's that's why the nutritionist job is so important, to be able to fine tune for that person. Because yes, guidelines are wonderful generally, but then specific needs. So
And it's
depending.
it's not something that everyone can do on their own, right? So
Exactly.
and I've had people come to me before and they're like, okay, well, I have these four conditions I'm trying to manage. How do I eat? And they're like, it's a lot to process and understand, and you end up with like conflicting things, right? So how do you meld them together? It's like, okay, well, I need low fiber, but then I also have heart disease and I'm being told I need to eat high fiber. And it's like how to prioritize
Yes.
and learn which ones come first and which ones are um, some of them are time limited, right? A lot of times a low fiber diet is time limited. There are some cases where it's not, but and
It wasn't
that comes
long.
first. Yeah. And I've had people that ask things like, "Oh, well, I have to do a colonoscopy prep. That's not going to meet any of these guidelines." I'm like, "You're right, and that comes first. It is what it is." Um, so there's all kinds of nuanced things. But now, where was I even going with that? Oh,
I think I interrupted.
no, I was going somewhere with the fact that that's like individual level intervention, which is so needed with food as medicine. But then there's also higher level interventions where you're changing policy. So you can change an environment, which would be changing food availability. And some of the work that's being done with that is increasing access to like fresh fruits and vegetables at food pantries, um, or having like more low sodium options, or like low added sugar options in food pantries as well. So changing the environment, right? Changing the food that's available to people. And then the kind of like next level up intervention would be changing policy. Um, and because that has a large reach, right? You're going to reach everyone in the state or whatever level the policy's at. Um, but then you run into the issue of, right, like, yes, you want to get a little bit granular so that people are getting a good outcome from it, but it can't get too granular because not everybody needs the same things. Um, and that's where like that's where we come in of making these recommendations of what does that look like and how does that all fit together and how can it improve the health for of as many people as we can. um yeah, a lot of times I think people think of food as medicine as this like this oh, you have to eat like kale and only vegetables and take and it has to be organic and this very sort of far reaching or out of reach idea.
Hmm.
And this really brings it back down to the basics as well as making it accessible or keeping it accessible, that it's something that everyone benefits from. Um, So it's very cool to work with that and work with something that matches my ideals, that nutrition security and good quality, like a good quality diet should be accessible to everyone and kind of meeting yourself where you're at and not worrying about these. fluffy extras that aren't going to make a difference if you don't have a solid base.
Yes.
Because I've had people that are like, well, I don't. I had somebody that was like, well, want to eat um I don't want to eat dairy and I don't want to eat wheat and I don't want to eat. And I'm like, well, time out. Why? Right. And kind of diving into, is it just because you don't think that those things are good, or are they actually like, are you actually uncomfortable when you eat them? Kind of teasing that
Yeah.
out. And it was really this health halo idea that I know
Being
we've talked
trendy
about.
more than anything else.
Yeah, they're like, well, it's not good for me. And I'm like, and we actually, the big lesson moment that we had was dissecting um, yogurt labels, right? Of a regular plain yogurt and then I think it was a coconut yogurt, and just looking at all of the additional um, sugar and fat that is in that yogurt. I mean, everybody's fat needs are different, but very specifically to this situation, we were looking at lowering that intake. Um, so it was looking at that and seeing that, reading the front of the package, kind of anything coconut based has been given a little bit of a health halo of, oh, it must be better for me.
Hmm.
And there's been like essentially negative press about dairy causing inflammation, and it depends, as all good answers.
Right.
That's like the third time I've said that today.
Mhm.
It depends on the person. Some people don't process it well, and yes, it can cause some inflammation from the stress of trying to process it. But a lot of people don't have any issue with it, so it's fine. Um, and so by looking at that, we could come to the conclusion together that, regular yogurt fits a lot better with that person's current needs. Um, so removing some of those health halos is important to me.
Yes.
We get so caught up in, oh, well, this is supposed to be better because whatever, a health influencer said so, or well, it says coconut, or it says chia seed, or, oh, one of my favorites, it's made with flax seed. Cool. If the flax seed isn't ground up, your body's not capable of digesting them, and you get absolutely no benefit from it.
Hmm.
Like the omega-3s and things that you would get from it, you have to grind it up first. Um, so it's not enough to just bake it into a chip. I saw flaxseed chips at the store the other night. Um, so it's, yeah, getting rid of those health halos as much as we can, while also, saying what is true about food as medicine, and showing that some what are perceived as simpler changes um, really aren't that simple, but also can have such a big impact, because it's simple enough to say, well, eat more vegetables, but then, okay, well, how am I going to get them? And dealing with that end of it as well, of the actual food access.
Yeah, and ketchup is not a vegetable. So it's, having
No,
ketchup on your fries does not constitute a vegetable.
no, no, not at all. Um, it's, and I know that came up in, or no, was it tomato sauce that comes up in like the discussion of school lunches because they were counting it as a vegetable? But I mean, that's a whole nother topic that I also dealt with last week, of what counts for different things for school lunches, um, and how they're measured. And it's not common knowledge, but for a lot of um, food service food, so like school food service specifically in this example, um, it's actually manufactured differently than the retail version.
Hmm.
So the example that came up was Fruit Loops. So, like the
Yeah.
Fruit Loops that kids can get in school are not, if they're part of the National School Lunch Program, are not the same as the Fruit Loops you get in the store.
And the Fruit Loops that you get in Canada are different than, 20
Yeah.
minutes across the border.
Yep.
Something about the dyes.
So from Canada to the US, I believe it's dyes. I was reading all of this too. I can't remember. Their sugar content might be different too. It might also be lower sugar up there. Um, for school food service, they're actually whole grain.
Ah,
Um, yeah, so it's at least 51% whole grain flour and or whole wheat flour and lower sugar.
I don't believe I've ever had Fruit Loops myself, so I don't.
Oh,
I
I
don't
definitely have.
know.
Um,
But with kids,
I love cereal, but it never fills me up. Um, so it's just not, I haven't had a bowl of cereal in forever because it's just not like, it's not worth the effort. I guess is like what it comes down to. Same thing with like a bowl of spaghetti. I just, I'm never full afterwards. So I don't go for those options. I go for the things that are going to make me feel full for longer.
Mhm,
So I
mm,
started using chickpea pasta because it's got more protein and fiber, and then I can still like have a bowl of I do like the rotini. I'm sure they make a spaghetti too, but I can have a bowl of pasta with sauce um, and feel full afterwards. I think
mm.
it's a fiber component for me because I can eat a bowl of oatmeal and be full. Um, that's what I've been doing in the mornings lately. But yeah, no, otherwise, like cold cereal, I have to eat like 3 bowls of it. And at that point, that's just so much food. But it just doesn't fill me up. I don't know.
Yeah, actually, I like my Honey Nut Cheerios. Um, I tried plain Cheerios. It just wasn't the same.
No,
So,
it's not. It's but dry cereal actually makes a great topping in yogurt. For anybody that's looking to replace their granola, granola is another food that's got a health halo and people think it's great, but it tends to be very high sugar. Um, and so you can either make your own, which is a lot of work,
mhm,
or just use a dry cereal instead. You'll get in potentially more fiber depending on what you use. It'll be lower sugar, also depending on what you use. But that is a much better option doing that. Or I'll do slivered almonds
mm.
because that gives it a crunch as well. And then you're getting into like more nutritional benefit than the granola has too. But I was talking to somebody who makes their own granola and puts nuts and things in there too. Same concept to give it crunch and some sort of texture variation from just plain, plain yogurt. Um, this is not at all what I intended to talk about today, but no, it's very good for me to kind of work through some of my thoughts because I have to do some writing about food as medicine and some presentations. So this definitely is helpful to work through our
Good.
thoughts, what we're doing. I might start using the podcast for some things too.
Mhm. Yeah.
That's in discussions. Because it's such a great resource for getting information out there.
Yes, yes.
Um,
And you can develop your use it as a sounding board to develop your thoughts too.
I do
And we'll
frequently.
take advantage of the knowledge.
Yeah, you can listen to me babble about uh, about food as medicine. It's yeah, yeah. One of the biggest things that I really appreciate about the way that we're doing this is that it is looking at vulnerable populations and their need for food as medicine services. Of course, anybody's going to benefit from nutrition education and implementing these things in their own life. Um, but if you've got more resources, it's easier for you to go to the store and pick a different cereal or pick a different, like, pick up some fruit instead of fruit snacks, right? Where it's cost wise, um, not as much of a burden, I guess is a good way to put that. Um, I mean, food costs have gone just up in general.
Yes.
Um, you can't, I know it used to be like the shopping trips where you bought meat were the most expensive, and now I feel like it doesn't matter. Now it's just, it's all bad. Um, and so I've actually been doing a lot more careful meal planning, when it comes to food in general, all of our meals, so that I don't have as much food waste. Um, what I was finding is that I was making like more food than we needed or not using our leftovers very well.
Mhm.
And so now I'm planning it out much better to use our leftovers or scale down the recipes, um, to start to work on that food waste. And it's really not like some people look at food waste from like an ecological perspective, right? Of like what's the impact on the environment to throwing that all out and can you compost it instead? Um, but there's a big financial component to that of like, okay, well, and I know it tends to be a barrier to people buying fresh fruits and vegetables. It's like, yeah, but they're going to go bad. And it's like, well, yeah, if you don't plan to use them in a timely fashion, you're right. They do just go bad. And so, or like having room to store it all. It's like, well, how much are you buying? Are you buying too much? Or do
Mhm.
you genuinely not have room to store it? So we look at like canned options instead. Um, but like when I wasn't a great example, I wasn't really planning, but kiwis were on sale. So I was like, oh, I'll grab some kiwis. I'm sure we'll eat them this week. We did not. They rotted in the bottom of the drawer.
Mhm.
So it's like, yeah, they were on sale. So it was a really great
But
price on kiwis, but I still wasted that whatever $3 that I spent.
yes, yes. That's one
Um,
of the reasons I go with for a lot of like cauliflower for it's a wonderful example. Ron doesn't like cauliflower. I love it. But if I bought a whole head of cauliflower, and yes, I know I could then you cook it and then cut it up and put it in baggies. To me, it's so much simpler to buy frozen cauliflower. I can take out a third of the bag, cook it up, put the rest in the freezer for a couple of days later. It just, to me, it just works so much easier than, I mean, of course, there's other things that we do eat fresh, oranges and apples and raspberries and strawberries are our main our main
that's awesome.
fruits and vegetables that we tend to always keep in the house. Um, but you know, for me just to have a lot during the summer, I think I eat more fresh because of the farmers markets. But during this time of year, especially since like this week, we have so much snow. We have not left the house in 4 days. We haven't left the house since Sunday morning. Um, you know, and so it's just, um, we've made sure that we have things on hand. Although I did notice that we only have 2 eggs left. But it's just knowing that um, we can keep things on hand in a shelf stable way. It's to me it works out for us best.
Yeah, and um there's again there's almost a health halo to go back to that around fresh produce, and yes, it's excellent. Frozen is sometimes just as good, if not better, depending on shipping, right? So you mentioned like farmers markets, that's going to be picked very, very close to ripeness, because it's very local. And so the longer that, say, for example, tomato's not a great one. Cauliflower. So the longer cauliflower's still planted, right, and attached to its roots, the more nutrients it's going to soak up, if you will, for an easy way to understand it, right, and absorb. And technically, you will have a more nutrient dense cauliflower. This can get really out of hand. They're all pretty much similar, but you can get some nitty gritty differences buying local or growing your own, because you're not having to pick it early, ripen it on a truck, or, just pick it before it's fully ripened.
Mm-hmm.
Apples are another good example of that.
Yes.
Or berries, where a lot of times they're picked before they're ripe and they ripen in the truck. Or think about bananas. When you go
Bananas.
to the,
It's a
they're,
complete room, a different in the. I worked at Tops Corporate, at Tops Supermarkets
yeah,
Corporate, and bananas are shipped raw, not raw, but green.
green as
No,
green can be.
yeah.
Yeah.
And then with chemicals, they're in a room that a
Oh,
chemical release.
kind of. Yeah. It is. It's a chemical that helps to ripen them, right?
Right,
Yeah.
right. I'm not saying a
Um,
bad chemical. It's just that I don't know.
yes,
I can't
it
remember
is.
what the. It,
It's the same thing as like putting two pieces of, I forget what they are. You can put, oh my gosh. There's a fruit that you can put with the bananas in a paper bag and it has the exact same effect.
oh,
That's
that'd
gonna
be
drive me
cool.
bananas. No, but I can't
No
remember
pun
it.
intended. Huh?
Yeah, right? Yeah, we'll pretend I intended that. Um, um, apples, pears, apricots, avocados produce ethylene gas, and
Ethan,
that
I knew it
helps.
started with an E.
Yep,
Okay.
helps to ripen the bananas. So for anybody that's going to freak out that Linda said chemicals,
Yeah.
it, it's also coming out of your apples right now.
Right. Right.
It's very normal. Um, so so yeah, bananas are a great example that they're shipped extremely um under ripened. And in a frozen, so think about like usually like smoothie blends and things have chopped up bananas. Those were picked ripe, chopped up, and frozen. So so if you think about it, you're getting something that has been ripened longer on the tree or bush or plant or vine or whatever it's grown on, and gotten a chance to absorb more nutrients before it was picked. So sometimes, back to my original thought, frozen can actually be better. Again, minute differences. I would never want somebody to forgo eating a vegetable just because they couldn't get it local or frozen and it was shipped on a truck. Like a vegetable, something is always going to be better than nothing.
Mm-hmm. True.
Um, so yeah. But frozen's a great option. And it's also a great option for when you have too much for some reason, right? Like, could I have chopped up those kiwis and frozen them to use in smoothies? Yeah, if I had caught them before they got as bad as they did. Um, or like back to our banana example, if you have children that think they want bananas that week and then suddenly they don't eat any of them, you can chop them up and freeze them and save
Mhm.
them to make smoothies or banana bread.
Good.
Or actually I have a like breakfast cookie recipe that I'm going to try, where it's mashed up bananas, oatmeal, and some nuts and honey and things. So it's it's also learning how to repurpose some of your food, and I feel like that's a little bit of a lost art. Um I'm reading kind of reading. a book. What's it called? It's like The Frugal American Housewife or something to that effect. And it talks about like food preservation, but like very old school food preservation that's probably not the safest method. But it's interesting to see how much they were able to save and reuse. Right? I'm double checking. Yeah, The Frugal American Housewife. It is um, published in 1829.
Ah,
So,
I
but it's,
have one of my, oh golly, I can't remember. It's all on homemaking, um, and it's from the 1800s. And what's funny is the recipes. Um, it's like use a coffee cup or use a teacup, because apparently they were different sizes, because
yeah,
yeah, it's just, and everything's by the pound or the pint. And I just it's but it's just a fabulous, fabulous book. I really have to get it rebound. I have to take it to a bookbinder, because I right now I just have it in a box because I don't want to lose any more pages. But it's just amazing that, the way things were done. Not all bad, but definitely not all good. So
it's we've learned, right? And this is I think it's important to look at historical information, um, right, to see what's been done and to learn from it and understand why they did it sometimes too is very helpful. But then looking at everything that we've learned along the way, sometimes there are extremely good reasons that we stopped doing something.
mhm.
Um, like I am no longer going to salt my pork and bury it in my cellar um, because I have a refrigerator.
Right, right. I
Like
just
there's
remember my mom growing up and talking about, now, the house that my mom grew up on a farm in Lakeview, which is Hamburg, south of Buffalo. And
see, I know where that is, but yeah, South of Buffalo makes it easy.
she what's really funny is the house that my mother grew up in, um Ron's cousin owns right now, which is so funny because I got to take my mom back to her house that she grew up, and
Oh,
um and
cool.
visit. That was neat. But now this is my mom's 97. When she was growing up as a child, her bedroom, during the winter, they would move her out of that bedroom. They would put metal tables in, and that's where they kept the meat cold, because it was that cold in that room.
She had
It
the coldest room in the house.
it's just, when you think about something like that, the refrigeration, of course, if they had an ice box, it was an ice box. But to keep, you know, if you slaughtered a cow, and to keep, it's just
Yeah.
so completely different. But you deal with what you have and how, things are. But that doesn't mean that we were going to do that these days. First of all, our houses are so overwarmed. I mean, you know, comparatively.
It's what I always think of too is, with meat storage, but then also if you were able to freeze it, meat defrosting, and just how often I hear like, well, my mom did it this way or my grandma did it this way.
Oh,
And
yes.
I'm like, yes, I hear you, and I hear that they lived a long life and they always did it this way, but we have this increased knowledge of like, hey, there are diseases and illnesses, or not diseases, I guess, illnesses that are so avoidable. Why don't we just make sure it doesn't happen? Right? Like, if you defrost your meat on the radiator all day versus in your refrigerator all day, like, at the end, you're still getting defrosted meat. However, when it's in the fridge, it's a lot less likely to grow stuff. And
Yes.
part of the disconnect that I find is people are like, well, it looks fine and it smells fine. I'm like, I'm sure it does. You're not going to break out a microscope to look at it, and it only takes a little bit that you can't even see to make you super, super sick.
Mhm.
Um, like I'm pretty sure I had food poisoning right before Christmas. I don't have any earthly idea where it came from. And it was horrible. I don't know. No one else got sick. It was just me.
Because it takes such a little piece of bacteria on something that then goes into your system.
Yep.
It's just the fact that when people say, well, we've been, people have been doing this for hundreds of years. Well, yes, but don't you realize until like the mid 1800s, doctors didn't even think to wash their hands before they operated on, I mean, just because people did things for a long time didn't make it right. For some reason, I was thinking the other day, um, you know, if I lived in the Middle Ages, and I'm thinking, oh my goodness, how horrible it would be to live in the Middle Ages. Just the disease, just the common ailments that everybody had. You know, it's just knowledge of something as simple as bacteria, which isn't simple, but at least our knowledge, our working knowledge of it, and preventing illnesses. Some things just as simple as washing your hands. And I know they made, during the pandemic, made a big thing about washing your hands. But if you're ever in, the ladies' room, I haven't been in the men's room lately, but in the ladies' room, when you realize sometimes people would just like perfunctorily run their hands for 2 seconds, if that, under some water running and then keep going. It's like,
It,
no, um,
so from a public health perspective, soap is one of the best inventions for disease prevention, and it's so simple, and I don't care what it smells like, and I don't care what brand it is. It's just about the way that soap works to remove the bacteria, right? So, hand sanitizer, this is an argument I have with my children. Hand sanitizer is not soap. Hand sanitizer will dry out the bacteria and viruses, most of them, and they're still technically on your skin. They're just dried out and now like non functional. Versus washing, the way that the soap works is that it helps to lift that bacteria, the viruses, and then also like physical dirt that you can see off of the skin and rinse it down the drain. So, for things like spores that might not be killed by a hand sanitizer, hand washing comes in. Um, and that's unbelievably important to remove a wider like swath of things, right? Right, like than something like hand sanitizer is ever going to kill. Because I definitely have run into that before. And it's pervasive. It's not just children. There's certainly adults, and I've seen people that are highly educated that don't wash their hands well, and I'm like, what are you doing?
oh, believe me, when I was at the office, these weren't children.
Right. Yeah, it's so I don't know why, and it's something that I feel like my children have had kind of drilled in, but I don't know if that's like a sign of the times because we all got so hand wash heavy with COVID. Um, we actually have a timer, and I've been trying to that's been hard. They've done great with being retrained with a toothbrushing timer. For some reason, hitting the hand washing button on the exact same timer is more difficult. Um, but I don't know why. Some Apple Watches have a hand washing timer built right in for
Ah,
anybody that has an Apple Watch. I know my son's has one. And I can't remember if mine does. So it completely depends on what iteration of Apple Watch you have.
And if you use it,
Yeah,
actually
and if
turn it
you
on.
use it. Well, in theory, it says that it can detect when you start washing your hands, but my son
Oh,
says that's definitely not true. He's never seen it just pop up.
yeah.
Um, but it's a cool function that if you can at least just press it, right? It's right there on your wrist for people that wear it. So the it just it's 20 seconds of your life and you're adding 2 more seconds to start a timer. Or I think it's like sing happy birthday twice. I saw a poster up by a sink once with like different options that in case you were tired of singing happy birthday.
Believe it or not, I do the happy birthday when I brush
Yeah.
my teeth.
And it's not, it's a small portion of your life to take a little bit of time, do it the right way, and prevent wherever we started with this illness.
Yes.
I think this started with like food safety and not defrosting your meat on the radiator. It's well, and it's funny because like my kitchen is the only room left that has like a stand-up radiator with a cover. And I could see how you could just stick something over there to keep it warm or to defrost or something because it's toasty. Um, I put my sourdough starter over there.
I was just gonna say if you use it for raising, your bread, if you're, have a yeast bread there.
Yeah, but now I killed my sourdough starter and I'm trying to restart it. It's a process. It's not working. I'm gonna need
Um,
to. My mom offered to give me some of her starter, but then I end up with a loaf of bread, and then I'm just eating bread and butter all the time and neglecting eating other foods. So it's a whole cycle. I'm like, do I want it?
we
And
go in
then
ticks with that, Rye,
yeah.
rye bread toast. It's like, oh my. And so we have to limit when we buy rye bread because we'll just sit and toast the whole loaf.
Oh, that sounds delicious. It's good stuff, and I don't know. That's another one that sometimes people are like, "Oh, well, it's sourdough, so it's better." I'm like, it's just different.
Yeah,
It's
it's just the yeast or the leveling agent is a little different, but it's still
yeah,
bread. So.
it's like a soda bread is not yeast based. It's still bread.
Hmm.
Oh, maybe I'll make a soda bread. I'm hungry.
Oh, I have to find it again. A wonderful recipe for dill bread, and it's made in is cottage cheese is one of the ingredients in this bread,
Oh, bet you it was
and
very moist.
it was boy, I haven't made that for a number of years. I have to find that recipe again. Um, and but I'm pretty sure it was more of a quick bread because I don't remember having to have it rise. Gosh, as I said, it was a long time ago, but it was a very good bread. I have to look that up.
Um, that's I saw one for a rosemary cheddar soda bread. I might make that. Not eat that.
When you were in Vermont, did you stop at the Cabot cheese factory?
No, it's
Oh my
people get
god!
so they're like, "Oh my God, you went to Vermont?" It's Bennington. It's
Oh
barely over the
yeah,
border.
yeah.
I'm
Well,
like, it's
it can't be too far because we stayed in Bennington on our way to Maine. My girlfriend and I one time, and um, Ron had we love Cabot cheese and Cabot we get Cabot butter and different things from the company, and so he sent them a note. They used to have the cheddar sprinkle cheese like that you could
oh,
put on popcorn and different things. And they wrote back that the factory that they were making that actually burned down, and
oh no.
so they sent us so many coupons of wonderful things. They were just calling and sending them an email about what happened to this product, and we love your products. I thought
Yeah.
that was really funny.
It's no, I don't like sightsee. I just kind of get in and
Yeah,
get out.
you're there for work and you get there
Yeah.
and come back.
It's like commuting to work. It's not like a trip, I guess is the best way to kind of put it. It's not for fun.
I remember a friend of ours, he was a salesman, I think copier salesman. And his wife said, well, when you're driving around, can you stop at such and such store and pick up such? He said, unless I'm selling them a copier, no, I really can't. You
Right.
know?
It's like I am doing things.
Yeah.
Yeah. Yeah. It's work. Um, well,
Oh my, it's one
oh,
o'clock already.
yeah. I was like, if I'm not hungry, it must be almost time. It is. Um, so if anybody's looking for me, I'm attempting to be more active on Instagram. It's at Beth Wyman _RD. If you're interested in seeing what the heck I was talking about with food as medicine, you can honestly, if you Google New York State Food as Medicine Coalition, it's the first thing that comes up. Um, and it's nysfoodasmedicine.org if anybody's interested in looking at that. Um, I think that's it. There's also the Optimize My Life Facebook group for anybody that has questions. And I think that there's a way to leave comments on episodes here too. If anybody has
I
any
believe
comments,
so, yes.
please, those are always welcome.
And if you're ever just listening in, there's at the bottom of the page, it has please input your message. And we've had that. We had somebody from India on
Oh,
one
cool.
time, and it was really, really nice. And so, we don't have necessarily the call in platform, but we can still um, converse through the little messenger.
Yeah,
And
there's still
so,
ways to interact,
yes,
definitely.
yes. Well, thank you, Beth. And as always, hopefully I didn't take you off track too much of what you were going to
No,
talk about today.
we discussed absolutely nothing I was going to talk about today, which is fine. There's always next week. Um, not a problem.
Alrighty. Well, you have
All
a
right.
wonderful week, and tune in again next Wednesday, noon Eastern Time, US. And with that, I'll say have a wonderful day. And I have to go
Yeah.
do some laundry. So
Oh, all right. Have a great day. Bye.
bye bye. Go eat. Go eat.
Yes.
Bye bye.